Now moving on to the respiratory system. Similarly to the cardiovascular system, it will also adapt as a response to long-term exercise. As our bodies train more regularly, our bodies get used to the demand placed upon us. This happens because the aerobic training allows respiratory muscles to get stronger, allowing our muscles to expand further. This is beneficial for the athlete as there will be more oxygen per minute for the athlete to disperse. The increase in ventilation means you are able to breathe in more per minute, meaning more oxygen enters your body, so you can deliver more oxygen to your working muscles, allowing you to essentially carry on exercising for longer. Additionally, reduction in submaximal breathing rate increases the strength of the respiratory muscles, and there will also be capillarization. An increase in the strengthening of the respiratory muscles allows our rib cage to expand more and obtain more oxygen. This means athletes can send more oxygen to the working muscles, as well as more oxygen going to the heart and respiratory muscles, so they can continue to work for the duration. So gas exchange occurs after aerobic training. Gas exchange of oxygen and carbon dioxide takes place in the alveoli. So the more training, the higher the capillary density goes, the more carbon dioxide we can remove. However, the capillaries disperse the carbon dioxide into the alveoli, which is attached to the lungs, and only then can the carbon dioxide be removed. So as we train, there will be an increase in alveoli, increasing the amount of waste products removed from our body, theoretically leading to a better performance as we are less fatigued. So the benefits of the respiratory system adaptions are our recovery time definitely decreases as our epoch time is decreased. This is because oxygen is being repaid quicker and the oxygen debt becomes smaller. So we can see there's a slight increase in the total lung capacity and the vital capacity. There's also a slight decrease in the residual lung volume and an increase on the tidal volume and pulmonary ventilation at maximal exercise. So this could be an increase in circulation or an increase in ventilation. Oxygen from the inhaled air diffuses through the walls of the alveoli and adjacent capillaries into the red blood cells. So overall, this means there is a better exchange of the gas and there's an increase in the respiratory surfaces for it to occur. For example, when you inhale, your intercostal muscles support you, for the reason being, if they're more efficient and stronger, you'll be able to get more air in and force more air out. The more we exercise, the more efficiently our body deals with the demands placed upon us, so we won't have to inhale as much and breathe so quickly. So as a result, our breathing rate decreases and drops. Health is strongly linked to how often we participate in exercise. So for example, an athlete who train regularly, like for example Mo Farah, will have a much lower chance of getting a lung disease than someone who doesn't exercise at all. In addition to this, if we don't exercise, our airways are most likely to get blocked up than someone like Mo Farah. Neuromuscular system. So now I'm going to talk about the neuromuscular system and how it will adapt to long-term training. Over long-term training, our muscle fiber types will adapt because, for example, a long-distance runner like Mo Farah will train his cardiovascular system and muscular endurance, his cardiovascular fitness and muscular endurance, and because they are training in such an intense way, the slow oxidative fibers will become a lot thicker and even more resistant to fatigue. Slow oxidative fibers naturally inhibit quite a low blood flow capacity and quite a high resistance to fatigue. They don't allow powerful contractions and wouldn't be very beneficial for a sprinter. However, are very suitable for a marathon runner or a long distance runner. Due to long-term training, the slow oxidative fibers will allow the runner to run further for longer, as waste products like lactic acid won't be affecting them as much. Secondly, an increase in myoglobin and mitochondria. This is beneficial because the more mitochondria you have in your body, the more ATP/PC can be produced, as this is the site of aerobic respiration, and essentially the more energy you have in the muscles. More myoglobin is definitely very beneficial, as this means she'll have more oxygen available in her muscles ready to be used immediately. Another adaptation is tendon and ligament strength. As the stronger these are, the less likely of injury. Training increases tendon strength, so for example, Shelly-Ann Fraser will have a much lower chance of rolling her ankle over in the tendon and ligaments, as her tendons and ligaments are stronger due to intense training. Fast glycolytic fibers provide very explosive short bursts of power, which is perfect for a sprinter, as these fibers fatigue quickly, therefore wouldn't be suitable at all for a marathon runner. These fibers are found in quite large quantities and over time grow in size. So an athlete was to do anaerobic training, their fast glycolytic fibers will increase in size, whereas their slow oxidative fibers will decrease in size. As we train, our muscle spindles get stronger and more pliable, meaning they can stretch further, so this allows the proprioceptors to detect the changes quicker. This is some data from the Wingate test. From this data, we can see that Sir Chris Hoy has 2,000 watts. This is because he would train very intensely regularly, whereas in comparison to a typical female student who only had 550 watts, which is significantly lower. However, if she were to train, she would be able to gain the strength in her legs and therefore be able to get a higher peak power. Additionally, another adaptation of the neuromuscular system is neuropathways. Neuropathways linking to target muscles become more efficient at transmitting the message as a result of long-term exercise, and ultimately will increase the reaction time and coordination of an athlete. This is specifically vital for an athlete similar to Shelly-Ann Fraser in order to get off the starting blocks quickly and effectively. Energy system adaptions. Both anaerobic and aerobic enzymes are used to produce energy via the conversion of ATP. So over long-term exercise, there will be an increase in both types of enzymes. This is important as we need the enzymes to ensure the movement or contraction can occur. Without the enzymes, ATP couldn't be broken down into ADP. The more glucose, the more energy produced. So for example, the more anaerobic enzymes increase to regulate the anaerobic phase of the glucose breakdown. So therefore, this provides an athlete with more fuel. Increased aerobic and anaerobic enzymes benefit an athlete because both of these enzymes play a role in either the production of energy or the breakdown of certain fuels to make energy. This benefits an athlete because more energy means the athlete is going to be able to work at a high intensity or work for a much longer period of time. In addition, fats are used for endurance-based activities. So, for example, long distance running, so like a marathon. Fats provide more ATP than carbohydrates because carbohydrates only need 1 oxygen, however fats need 2. This means that fats take longer to oxidize, however more energy is produced. This benefits an endurance runner because fats are used to fuel the body when glycogen levels deplete. This energy can help an endurance athlete because near the end of a marathon, the athlete will use these fats to complete the activity. Another adaptation to the energy system would be an increase in the tolerance of lactic acid. This represents so a trained athlete will be a lot lower as they were in this graph, as they're a lot more tolerant to the lactate. So the higher the intensity, the longer the duration, the more likely an athlete is to experience lactic acid. However, the more exercise an athlete does, the more tolerant they will become to lactic acid. So for example, if someone doesn't train at all, then their lactic acid buildup will occur quite quickly. But when there is a lactic acid buildup, an athlete may also experience discomfort or pain, which then limits the ATP production and causes the athlete to fatigue a lot quicker than if they were fully trained. We also train our bodies to prevent OBLA for as long as possible. Here we can see during exercise, blood lactate increases. So skeletal adaptions. A long-term adaptation of the skeletal system is primarily based around the increase in the conditions of the bones and how they deal with this. So, for example, weight-bearing exercises. The adaptions are an increase in bone density, increase in calcium stores, increase in cartilage thickness and synovial fluid production, and tendon and strength of ligaments. Exercise places force onto bones. As a result, there is an increase in calcium stores. This is because there are cells called osteoblasts that constantly bring calcium into the bones. Exercise is a stimulator of how fast osteoblasts complete this function. In addition, the stretch in ligaments will increase. Ligaments are tissue that connects two bones together. With exercise, this connective tissue will become more pliable and resistant to the stress placed upon them. Ligaments can become easily damaged if they're weak and not very pliable. Athletes like Mo Farah have much more pliable ligaments in comparison to someone who doesn't train, because they are constantly being trained in stretch. Furthermore, the thickness of the cartilage will increase as it needs to become a better shock absorber, decreasing the chance of injury during physical activity. Moreover, another adaptation is an increase in synovial fluid. Synovial fluid acts as a lubricant which helps the joints and cartilage to move around a joint. So an increase in this will decrease the risk of injury and allow an athlete to carry a movement for longer periods of time.